PQQ gets sold like a tiny power plant technician. More mitochondria, more energy, sharper memory, slower aging. Before we chase the shiny claims, what is the honest first sentence? Is this a nutrient we know people need, or a supplement with interesting biology and a pretty thin human file?
Honest first sentence. PQQ is a redox active quinone found in small amounts in foods and studied as a supplement, not an established essential vitamin for humans. The reason scientists care is that redox molecules can pass electrons, influence oxidative stress signaling, and in preclinical work touch pathways tied to mitochondrial function. That is a plausible switchboard, not automatic proof of better energy in a person. A lot of PQQ excitement comes from mitochondriogenesis language, making or maintaining the cell's energy machinery. But in human supplement studies, we usually do not see direct proof that someone grew a meaningful new fleet of mitochondria. We see proxies, cognitive test scores, BDNF, oxygenation, fatigue-adjacent perceptions, or oxidative stress markers. Useful clues, but not the same as clinical outcomes like fewer falls, less dementia, or improved disease control.
So if someone asks, what is the best human result? Are we looking at the 12-week Japanese Cognition trial? It used about 21.5 milligrams of PQQ disodium salt daily in adults who were middle-aged to older, and it reported improvements across memory, attention, reaction time, and executive function. How impressed should we be?
Moderately interested, not converted. The design was randomized, double-blind, placebo-controlled, which is good. The population was also relevant. People who felt more forgetful with age, but were not necessarily diagnosed with dementia. The caution is scale and multiplicity. When a small trial reports many improved cognitive domains, you want independent replication, pre-specified hierarchy, and real-world anchors. Names remembered, errors reduced, daily function preserved. There's also a 2024 trial in older adults with mild cognitive impairment, but it tested a blend, dihydrogen-producing minerals plus PQQ, twice daily for 6 weeks. It found higher BDNF within the treatment group, better orientation scores versus placebo, and changes in cerebral oxygenation and brain metabolites. Interesting, yes. But because PQQ was not alone, the trial cannot tell us how much was PQQ, hydrogen chemistry, expectancy, or chance.
The energy claim is the one people feel in their bodies. But if PQQ is supposed to help mitochondria, why do the human studies sound more like brain tests and questionnaires than a clean, you produced more ADP result? Is there an exercise study that gets closer to real performance?
Before performance, one boundary. Supplements are not vetted like prescription drugs before they reach shelves. Xai's general advice is to treat products as active substances, because formulas can differ from what studies used and may interact with conditions, medicines, or surgery. For PQQ, that matters because long-term human safety, kidney-specific data, pregnancy data, and high-dose data are limited.
Okay, with that boundary in place, what did the exercise paper actually show? It gave 20 milligrams of PQQ 1 hour before an exhaustive treadmill test, compared with NMN, a combination, or placebo. Was that an energy result, or something more specific about noticing internal body signals?
More specific, interoception is the nervous system's reading of internal signals: breath strain, heartbeat, discomfort, readiness. In the study, several scores changed over time, but body listening was the only domain with a significant group-by-time interaction, and the PQQ group improved. That is intriguing for athletes, but it is not evidence that PQQ increased VO2 max, speed, or mitochondrial capacity. A different pilot study tested a combination product containing silymarin, PQQ sodium salt, and myricetin in 20 wine-drinking participants. It reported lower circulating ethanol at 120 minutes and changes suggesting better antioxidant balance, like increased total antioxidant capacity and lower 8-isoprostane. But again, it is a blend, single-blind, tiny, and acute. It should not become a hangover hack or permission to drink more.
So, who is the best fit user, if anyone? Is it the healthy 25-year-old chasing anti-aging, the older adult noticing mild forgetfulness, the exhausted athlete, or someone with a medical diagnosis hoping mitochondria will fix the root cause?
The least inflated answer is a person similar to the Cognition trial, older and noticing everyday forgetfulness, might consider a time-limited experiment after basic causes are addressed. Sleep debt, depression, hearing loss, medication effects, B12 deficiency, alcohol, and uncontrolled blood pressure can all look like brain energy problems. If those are ignored, PQQ becomes a shiny distraction from higher yield fixes. Dose-wise, the better-known Cognition trial used 21.5 milligrams per day of PQQ disodium salt. The exercise study used 20 milligrams once before testing. That does not justify stacking multiple products or chasing high doses. Pick products with clear PQQ amount. Avoid proprietary blends when possible and favor third-party quality testing because contamination, mislabeling, and formula drift are supplement world realities.
If someone runs a cautious experiment, what should they measure so they do not fool themselves? Should they track memory lapses, reaction time apps, training notes, sleep, or just the feeling of more energy? And how long before maybe it works becomes probably not worth buying?
Use clinician boundaries if you are pregnant or trying to conceive, have kidney disease, are medically fragile, take multiple medications, have a procedure coming up, or are treating cognitive decline, neurologic disease, diabetes, cancer, or cardiovascular disease. Also stop and reassess if you get new symptoms. Limited adverse events in small trials are reassuring, but they do not establish long-term safety across complicated bodies. My bottom line, PQQ is mechanism interesting and clinically underbuilt. The best single-compound human signal is Cognition in older adults using about 21.5 milligrams daily for 12 weeks. Exercise data suggest a narrow body awareness effect, not proven performance. Blend studies are hypothesis-generating. If you try it, make it time-limited, measurable, product-conscious, and secondary to sleep, exercise, medical evaluation, and risk control.